Good? All right, so I'm going to show you guys how to do knee girth measurements. Fun. Cool, yeah, I guess. So we can go ahead and look at your knee. Do we got a good view there? Awesome, we do. So the first thing you want to do is you want to kind of find the middle of the knee. All right, so often you kind of look for that joint line. You guys probably remember palpating that your freshman year. All right, and so the first thing I want to do, you can kind of find the patella and kind of go like right in the middle, and you want to mark that as your middle point. So here's the base, the sides, the apex, and so kind of here's the middle of the patella. And then usually, depending on how much swelling your patient has, depends on how high you want to go or how low you want to go. And so usually you'll go at either 2 or 3 inch increments, and you'll mark kind of the areas that you'll want to measure around. So I'll go at 2 inch increments. So 2 inches up from here. All right, and then 2 inches up from there. And you can go as high as you want, you know, depending on their swelling. If they're not that swelling, you might not need to go that high. And then I'll do one more. Try to keep a straight line. And then you also want to make sure that you go below. So we'll do the same. We'll go 2 inches below. All right, and so then you kind of have all your markers, so I like to do that first. So then what you want to do is you want to measure each area 3 times. So you want to make sure that you pull the tape out and get it nice and loose. Make sure that, depending, like I'm going to use inches to measure, so I'm going to want that on the outside, okay? And then you just slightly put it underneath the knee. Go ahead and relax, Michaela. And then I like to go ahead and kind of make it nice and loose. And then you want to make sure that you go ahead and kind of come around and making sure that it's on 0, okay? And then coming around and taking the measurement. So it looks like she's about like 14.5. Now make sure that when you're doing it, we're not doing things like this, coming in at an angle, and then we're not doing things like this, such as coming up like that, all right? You really want to make sure that it's going nice and firmly and straight around, okay? And so that would be one measurement, so I would take that out, and then I would go ahead and do it again. $14.5, and you want to make sure you do at least 3. Loosen it up, because you want to take the average of that. And so, you know, she's not swollen, so she's right on the dot. She's 14.5 for all of those, so her measurement for that would be 14.5. And then you want to do the same thing as you go up. No, and go down. But what I always do is I always keep the string behind the knee, and then I go ahead and slide up, and then I'd go ahead and take those. So then, so she's about just 15.25, just about. You would do that 3 times, take the average, and then come up to the next spot. Oop, that's not good. She's about 17. And then again, you would just do all these sites 3 times. You can get that 3 times. And then you would take the average at each site, all right? And you can. So then we would do that one leg, and then you want to make sure that you always go ahead and do the other leg as well, because you always want to be able to compare bilaterally. And so obviously the leg that's swollen the most should have higher increments. Again, the same thing applies to any part of the body as long as you're marking and going at the same increments as far as taking any type of girth measurements. Hope this helps.